Let's talk to Christina Marriott, who's the Chief Executive of the Royal Society for Public Health, who joins us now. Good afternoon, Christina.
Good afternoon.
Really appreciate the time that you're spending to talk to us about this. How did we get here? That's the question I've been asking all week. How did we, a very advanced nation in the world who took all the necessary precautions to combat COVID, how did we get to 100,000 deaths in less than a year?
I think it's a whole series of decisions actually going back quite a number of years. So the first thing we need to acknowledge is this isn't just the virus, this is about decisions that have been taken. And as you've said, we are the first European nation to get through the grim total of 100,000 deaths. We should know that the deaths across the world will change in time. So far, the second wave through autumn and winter has been in the Northern Hemisphere, so Europe is particularly badly affected, as is Northern America. So it will change over time. But we do need to acknowledge we have the fourth highest mortality rate per million people in the whole of the world. And that's because of the decisions we've taken over lots of years. So before we even were in this pandemic, we weren't in a great place. The government had cut back the public health grant from 2015 onwards. It hadn't learned the lessons of its own modelling of what we would do in a pandemic, so it hasn't applied the lessons it's learned. It didn't task Public Health England to be concentrating on the pandemic. And more than that, the state of our nation's health as we went in wasn't that good. We have internationally really high levels of obesity, really high levels of being overweight, really high levels of diabetes, and we've got really high levels of inequality in our country, all of which we know has played out in the pandemic. And then, of course, since the pandemic started, we've had a government that hasn't made the right decision quickly enough, strongly enough, stuck with it for long enough. They have flip-flopped on their decisions. They've gone in too late into lockdowns. They've opened them up too fast and too quickly and too thoroughly. And if we are going to get the virus under control in the UK and get our economy back up and running, we need to get the virus under control. And that means we need to allow the lockdowns to go on long enough. Dr. Susan Hopkins is exactly right. We need to keep lockdown until the virus is under control, and then we need to come out very gradually, testing as we go, because at the moment all we're doing is bouncing in and out of high virus, back into lockdown, back into high virus. We need to get the virus level in the community low enough that things like test and trace can work.
You say that we won't... Sorry, no, you continue, please.
No, as a side, we also... So I've been quite negative about government so far. I will congratulate them on what they did with vaccinations. They have done very well in getting manufacturing in the UK. They've done very well in buying some. And people like the MHRA and our scientists, actually, have done a phenomenal job in getting us vaccines that work. And the NHS is just doing the best job on earth at rolling it out. We are doing so well at getting vaccinations rolled out. In contrast, where we've done really badly is test and trace. We've never got the virus low enough that test and trace would be the right approach. But more than that, the government ignored their really good local public health protection teams, who week in, week out have returned 98% of contacts traced and spoken to, as opposed to the national test and trace system that was set up, that ignored what was already in place, that was put out to private companies, that has failed in its entirety. It just doesn't reach enough people. So the government made some fundamental poor decisions about how they were going to respond to the pandemic.
What about us, the great British public? Because it's fair enough to blame the government, but I wonder if we can hold a mirror up to ourselves and say, we could have done better. You mentioned earlier on about we weren't in a great state in terms of the nation's health previously, but we are a country where people live to 100 years old quite regularly now. It's getting more and more regular that we're in a better state than we were in, certainly when I was a youngster and we thought that 60 years old was really old. We're in a much better state than that. And some of the illnesses that you describe, people might look at as kind of lifestyle choices when you talk about obesity. So I'm not saying exclusively, I'm not saying they're exclusively so, type 2 diabetes and so on. People might look and think, well, some of those are lifestyle choices. I wonder if we can look at this pandemic and those 100,000 deaths and say some of that comes from the lifestyle choices, quite apart from the mistakes the government makes, the lifestyle choices that we've made.
So it's really interesting what's happening with life expectancy, actually, because we did have that really big growth in life expectancy, and it's slightly stalled. And it's stalled in the UK and the US more than it's stalled elsewhere. So we know in some areas, and I mentioned earlier that we're a country of high inequality, particularly in health. In some areas, life expectancy is now actually beginning to drop for women who live in the most deprived areas. So some of that life expectancy that we've seen grow over the last century is now falling back. And yes, we tend to talk about that as individual behaviours or individual lifestyles, but it's inescapable that it affects some people more than others. So we know that levels of obesity and overweight in our most deprived communities are twice that in our least deprived communities. We see that in the children, we see it in the adults as well. And we also know that, for example, a healthy calorie, if you look at how much food costs in the UK, healthy food costs loads more than unhealthy food. So a healthy 1,000 calories costs about 4 times the cost of an unhealthy 1,000 calories. So if you don't have much money, then you are driven towards eating the least healthy food. And probably, if we look at what shops there are in our most deprived communities, you will see they are fried chicken shops. They are not greengrocers. You can see the whole of the food industry drives towards foods that make you obese. And so we would talk about the obesogenic environment. So our obesity is being driven by our transport systems, the fact it's not very easy to cycle in many places, the fact that public transport in a lot of places is being cut back, that our advertising targets people towards the kind of high fat, high sugar, high salt food that we all know is very bad for us. It is also, in evolutionary terms, very difficult to say no to because it's the stuff that tastes good on the whole. But we have a food system that drives people towards high calorie, dense food because it's cheap. So if you don't have much money, it's very often the way that's easy, that's affordable to feed your children and your family. So it's not necessarily just a case of individual decision making. It's not just a case of whether people decide to do it. It's also the environments they live in, whether they feel safe to go outside to exercise, whether there's a park for people to exercise. And we can see this when we look at the stats. So we see that overweight and obesity and diabetes are all much more common in some communities than others. So they're more common in urban communities, they're more common in the more deprived communities, they're more common in some ethnic groups, all of whom are the ones who have been most badly affected by COVID. So we know it's also relevant in the COVID pandemic.
Do you think then, are you saying that the health inequality that we find in wider society generally, pandemic or no pandemic, is partly causing this level of deaths that we're experiencing?
It is absolutely a driver of it. So we see a huge inequality year in, year out, and it causes people to stop being healthy in their 50s. It causes people to die in their 60s. I mean, this is an enormous difference in life expectancy that we have in the UK, but it's absolutely driven some of the deaths under COVID. So we know that some ethnic groups, like African Caribbean, the Bangladeshi groups, are up to 4 times more likely to die of COVID. And we know some of that to do with inequality. And we see the same around deprivation as well. So people living in poorer areas are more likely to die anyway of health inequalities, but that also plays out under the COVID pandemic. They are more likely to get the virus, and they are then more likely to be badly affected by it. And sadly, tragically, they are more likely to die.
What's the solution? What should the government do? You know, at some point there will be a national inquiry, won't there, about the level of deaths that we've suffered during this pandemic, and there will be hopefully some kind of positive outcome of that national inquiry. How should society then change to embrace the inequalities that you talk of, which seem to be fundamental parts of the fabric of the society that we live in? How on earth can we change that?
So the Prime Minister has promised us an inquiry, and we think it is absolutely necessary. And one of the things we would like to see out the other side of that actually is an investment in public health. And at the moment, there is a big investment in the National Institute for Health Protection, the people who are running Test and Trace. But actually the investment in public health seems to be going in the other direction, and that is precisely the lesson we shouldn't learn out of this pandemic. What we should do is invest in active travel. We should protect people against the food industry that is driving very, very unhealthy food into all of our shops and all of our local systems. We should help people to travel to work safely, get the kids to school safely, on a bike, walking, making it more accessible. We should embed exercise into day-to-day life. We should encourage employers to let their workers stand up occasionally and walk away from their desk and be less sedentary. We should all take up the joy of exercise if we can. There is real drivers of our obesity crisis and our diabetes crisis. And all of that inequality, and it won't reverse unless we do. So let me give you a couple of really good examples of what worked. Banning smoking in inside public places had a huge impact on smoking and a huge impact on inequality, actually. And had we not done that, we would have been in a much worse position under COVID, because we would have had many more people with damaged lungs going into this. We saw the same with something called the sugar levy on sugary drinks, where there was a taxation that was brought in for high sugar drinks. The industry was given a really long warning, and what happened was they reformulated their drinks to have lower levels of sugar in it. They didn't lose any of the market. People kept buying as many drinks as they ever had, but they just had less sugar in them. So we've done these big public health moves that have helped the population's health so far. We just need to do more of them. So we need to extend the sugar tax on sugary drinks to milky sugary drinks and to food, so we can help all of us eat healthier food, even when we're eating processed stuff. So there's lots we can do. We just need to be brave enough to do it. We know what works. It's those big legislation things that change the environments we live in, makes the whole population healthier. And that's what we should be doing as a nation, because it's just not right that so many of us die or are unhealthy younger than we need to be.
Really appreciate your contribution to the programme today. You've given us a lot of food for thought, so to speak. No pun intended. Christina, thank you.